Hi, good morning, everyone. We are back again with the Nema Health Show. Today, we are going to talk about oral cavity. We have with us Dr. Ritika Malhotra. Welcome, Dr. Ritika Malhotra. I would like to have a few words about her. So, Dr. Ritika is the proprietor of the Perfect Smile Dental Clinic. She is currently working as HOD at the Dental Center at the Apollo Clinic and the Apollo Hospital, Gurgaon. She was earlier with the Fortis Memorial Institute and also with Columbia Asia and Veritaas Healthcare as HOD. She practices all fields of dentistry and general dentistry with a special interest in the cosmetic and the design industry of the dental department. She's completed her BDS from India and thereafter she went for cosmetic dentistry from University of New York. Dr. Ritika is here. We welcome her. Dr. Ritika.
Thank you so much. Thank you. Good morning, everybody. So today I'm here to talk about the importance of oral care in elderly. So when I say importance of oral care in elderly, the first question which comes to mind is why is it more important to take care of your teeth or your oral health in elderly, more than the adults or children? So, well, as the problems, associated with the elderly are different than that of the adults, the treatment or the care also, is different. So, because of the lifetime of chewing, grinding, general wear and tear, and also with the medication and medical conditions at that age, the problems also are different. It may cause more problems during that time. So, just to name a few, when you talk about tooth decay, so tooth decay is anyways generally there throughout the life, whether you're talking about children, you're talking about adults, or you're talking about elderly. But why is it more during elderly? You tend to see patients coming, elder patients coming with tooth decay more than the other. That is more to do with the fact that the intake of sugary food is more during that time. The tendency to snack in between your meals is much more. Plus, the saliva production is lesser during that time, and the body repairs itself at a lower pace. So all these factors together, they create more chances of having any kind of caries. And also, in case you tend to have more dental caries, there is more pain associated with this. There is more difficulty of chewing and eating. So your eating habits or your eating pattern and the amount of the food that you can eat goes down. So if that goes down, the nutrition that the body needs at that age obviously goes down, because you tend to avoid a lot of kind of food which you're not comfortable in chewing. So eventually you end up eating lesser amount than you need. So the nutrition also goes down, which causes adverse effect not just on your dental health, but your entire body, because your body needs food. So if the right amount, right nutrition is not going, the overall health is compromised. So it is very, very important at that time to make sure that you keep your teeth very clean, and the dental caries, the chances of more dental caries goes tremendously down. So not just this, gum disease. When you talk about gum disease, the most common thing is periodontitis. Periodontitis, people are aware of this. They, in layman term, they call it pyorrhea. So this is a very common thing that we've seen in elderly. So the gum basically gets inflamed, infected. That is because whenever you eat or drink, because of so many years of negligence or not taking care of your dental health, because it's the most neglected part of your body. So there's a lot of tartar and food and all deposits happening around your teeth, in between your teeth and your gums. So wherever there is dirt, there ought to be bacteria there. So those bacteria, what they do is they cause infection and inflammation in the gums around it. And gums being the surrounding structure and the supporting structure, when they get infected, how we get to know is, you'll have redness, you'll have soreness in gums, you will feel, awkward in your gums, you'll have bleeding from the gums. And, we have a tendency to start changing a toothpaste, a toothbrush, maybe start using a mouthwash thinking that, that will take care of your the bleeding which is happening. But actually it is happening because of the dirt and the bacteria around it, which has inflamed the gums. So because the dirt is still there and the bacteria are still there, so what happens is that reaches the inner layer. That means the bone, which is actually holding the teeth. The bone also gets infected. And when the bone gets infected, there is no supporting structure. So the teeth eventually become very loose. You must have heard and seen people saying that, at a particular age, maybe after 60, 65, it is very normal to have loose teeth. It is a common thing. Or, a flaring of teeth. We have a lot of patients coming in saying that, we've developed these gaps in between our teeth, which was not there earlier. So these gaps are basically because the teeth have started shifting, because they don't have that enough support from the bone. So now they are free to move. So they become loose. So this is like very, very common. And not just the teeth. When you talk about periodontitis, it is also has been seen, the researchers have shown that it is linked to heart disease. The chances of heart disease are double in cases where there are periodontitis conditions in the mouth. That is because the bacteria, they travel through the bloodstream to the heart, and the bacteria get deposited, or they infect the walls of the heart, the inner lining of the heart. So the chances of heart attacks, fatal heart attacks, are much higher in cases of periodontitis. So it is, very, very important to take care of your gums around. And the gums, because of periodontitis, the gums go down, they recede. So when they go down, you feel that your teeth appear longer. So basically, the root, which is the sensitive part, gets exposed to whatever you eat and drink, because the gum goes down, the gum recedes. So there's a lot of sensitivity also in your teeth. When you have hot, you have cold, you feel your teeth have become more sensitive than they were at an earlier stage. So gum diseases is also something which has to be really taken care of and not neglected at all. So
So this is
apart
very
from this,
interesting
yeah,
to know, Dr. Ritika, that
yes.
we always thought that okay, if what will go wrong is one tooth will come out and that's all, and we can
Yeah.
fit another one. But it is
Right.
really an eye opener to know that if you have a dental disease, it can actually affect your heart. That means no
Yeah.
organ of the body is independent. Everything is affecting each other, right, Dr. Ritika?
Absolutely, absolutely, absolutely. And
Yes.
the most important part is that people feel that oral care, or teeth is something that you can ignore, at a certain age, like elderly, because of arthritis, dementia, the skills to brush, or the oral hygiene routine, or the dental care, takes a back step, because there are more issues, more serious issues, or more issues of the dental, of the general health, that needs to be tackled with or taken care of. So the skills of brushing, they start going down. The people lack the skills of brushing, and the oral hygiene takes a back step, which is that's why it is very important for people to be aware of the fact that it is really interlinked, as you said, to all the parts of the body. So you must take extra care that time. So not just this, you talk about diabetes. So people who are diabetic, they tend to have more gum issues. It is interlinked again, because diabetics have the healing capacity of the body is much lesser in diabetics. So the way the gum disease would have progressed in a normal individual, when I say normal, I'm talking about a person who doesn't have diabetes in this case. So when a non-diabetic person has periodontitis or a gum disease, it might just progress in a very slow, at a very slower pace as compared to a person who is diabetic, because the healing anyways is slower. So it progresses very, very fast. So you tend to, at a very early stage, you tend to lose your teeth, so which we really want to avoid. So taking care of the gums and not ignoring these kinds of symptoms when you get to see, and not trying out your own stuff by changing the brush or the toothpaste. It is important to take a professional help or an opinion. So at that stage, I would really recommend that you not ignore it and go to a dental dentist, or a dental surgeon, and get an opinion there and get it corrected at that stage before you end up losing your teeth. So then you talk about things like, yeah, sorry, you were about to say
So
something?
here, so it is
Yeah,
a very important point to take home is that
yeah,
whenever we have these minor problems, as you said, that we try to change the toothpaste, we try to use a mouthwash, we try to
yeah,
use a new brush, or we try to blame something, and then we go on to deshi nuskhas or something, some kind of neem
true.
paste or long or this and that. But we don't try to correct the root cause problem.
Sure.
We don't ask a professional what is the root cause, how to handle it. We should
Yeah.
target the root, not the stem. And then, unless you damage the root, the disease will never go away, right, doctor?
Absolutely, absolutely. Okay,
Yeah.
and
Yes.
not just this, a very basic or a common thing that we get to hear is foul smell from the mouth. So that is something which is very, very common, and people don't talk about it that much. Even if you try to read up things, you won't get to hear a lot of things or a lot of things written about it. That is because people feel it is just related to the local cause. Yes, the local cause is the most common cause. That means you're talking about any kind of dirt around your gums or around your teeth. Wherever there's going to be dirt, obviously it's going to, like, you have a fresh apple or you have a stale apple. A stale apple would always stink, the fresh apple won't. So similarly, when you have your teeth which are not infected, there's no foul smell. But where, in case they are infected because of the local causes, you tend to have that foul smell coming from your mouth. So that odor is there. But it is not just about your teeth. There are chances that that foul smell could be related to the underlying structures or underlying body parts. As in, any infection in the lungs could also represent as any foul smell coming from the mouth. And not just this, any kind of acid reflux or any kind of gastrointestinal issues, as in stomach problem, acidity, as we commonly call it. Those kinds of things also could lead to foul smell, which is very ignored or neglected. People think it is just related to the mouth. So these kinds of symptoms which you see in the oral cavity or in the mouth or commonly, that could be associated with a lot of deep underlying causes. So it should just not be neglected. So now coming to something like decreased amount of salivation, so, or a dry mouth, when it is also called xerostomia in our terminology. So which is in layman term, it's dry mouth. So dry mouth is also has been associated with an elder age, that kind of age. Dry mouth usually is not associated with adults. It is most common in elderly. That is because a lot of medications have a lot of side effects. Things like medication like hypertensive medication. That means your BP medication. So that you've been taking for a very long time. Not just that, depression medication. All these medicines, because they've been taken for years together, start showing their effects or side effects or some kind of symptoms at this age after so many years. So how you get to know is your mouth keeps getting very dry all the time. So because it is dry, the normal washing away which the saliva does, which your spit does, is not happening. So the normal washing away is not happening, so the food remains there, more chances of decay. So all these are associated with dry mouth. Not just this, your lips get cracked, chapped, your tongue becomes swollen, and you have difficulty in chewing, in swallowing, in speaking. So dry mouth is also something which is very, very important and should not be ignored. Even if it is associated with medicines which you can't stop, at least you can take care of the dry mouth by having, there are a lot of artificial saliva that is available in the market, some kind of chewing gum, some kind of sprays, lot of things to make sure that the saliva is still there. It is not, the mouth doesn't remain very dry. Having a lot of food, having a lot of fibrous food, having a lot of water intake increase. So a lot of factors can help to make sure that the mouth doesn't remain dry for a long time. So that should also be taken care of and not just ignored. Then,
So, Dr. Yes, I would
yeah,
like to interrupt that you talk
yeah, sure.
about artificial saliva. So this is the
Yeah.
first time for me to hear that. We understand that we
Hmm.
have to drink more water, rinse the mouth.
Yeah.
So now can you tell me about artificial saliva? What is it and how it is used?
Okay. See, artificial saliva comes in lots of different forms in the market these days. It's available, from basic chewing gums to sprays to gels. Basically, the motive of all of them remains the same, no matter which one you choose, but it remains the same. It keeps your mouth wet. So it is doing the job which your saliva usually does. So keeping your mouth wet is the trick. So when you're keeping your mouth wet, all the washing away action of the washing away, the natural washing away of food which is left behind in your mouth after you eat is being taken care of. Plus, because the mouth is not dry, the problem of swollen tongue or any kind of difficulty in eating or drinking or swallowing is decreased. So basically it replaces the normal saliva. So you can use any form of it. The whole idea the motive should be the same, that keep it as wet as possible, like the natural way you have your wet mouth. Yeah.
So what would be
Yes.
the daily cost of this saliva treatment, the artificial
See,
saliva?
it's not. I mean, I would not want to mention the amount because it varies. There's a wide range. It really
Oh,
depends on you which brand would you want to. But yes, I would want to say it's not expensive. It's cheap enough, and if you actually consider the benefit that you get, it's absolutely cheap enough. Yeah.
okay.
Yes. So
Please.
okay, then you talk about things like oral cancer. That is something which is very serious and very important, which you should not ignore. So oral cancer, the chances of oral cancer increases with age. So it increases with age because you've had a lot of wear and tear happening throughout your life. You've maybe misused a lot of parts of the body, like if I talk about oral cavity, I'm talking about smoking, tobacco chewing, your aggressive alcohol use. So if you've done it over a period of so many years, the results start showing at that time. You start seeing the outcome of whatever abuse you've done to your mouth. So, and plus, moreover, because the healing capacity has gone down, the immunity has gone down. So, the chances of oral cancer increases again. And not just this, the causes like ill-fitted dentures. You've seen people, we've seen cases with ill-fitted dentures who've got used to, they've started living with those ill-fitted dentures, and you ask them, they'll tell you that we eat everything with it. But ideally, the problem is that even if it is poking anywhere on your skin or on your cheek, which you've started living with, but that poking, that constant irritation to the soft tissue or the cheek or any kind of part of the body, that chronic irritation eventually might lead to oral cancer. So which people feel that that's okay, it's just an ulcer, we're used to it, it keeps coming on and off. But you should not ignore those kinds of non-healing ulcers or any kind of injury to your oral cavity because of ill-fitted dentures, or it could also be because of grinding. People talk about night grinding, clenching your mouth. It is very, very common. It is associated with stress and other factors. So any kind of clenching or aggressive grinding of your teeth causes your teeth, the upper layer, to wear off. And you get those sharp edges here and there. So those sharp edges of your teeth, they also poke into your gums or your cheek or your soft tissue, your tongue. So that also eventually over a period of years would or could lead to oral cancer. So, in case you have any kind of small ulcer coming or any kind of thing which is poking, whether it's a tooth or an ill-fitted denture, it should just not be ignored. You must take a professional opinion about it, get the root cause rectified, and then make sure that nothing is coming up. Even if something is coming up, if we treat it at the right time, even if it's oral cancer, now these days the technology and the advancement has reached to the level that we can happily and easily treat the patient if it isn't in the initial stage. So it is very important not to ignore this and seek a dental opinion. So that is
So,
something which is very, very important. Yeah.
So, Dr. Ritika, here we
Yeah.
take home a message if
Mm.
the tooth are loosening, if they
Yes.
hurt, if there is sensitivity, if there is
Yes.
increasing gap, if we feel
Yes.
that we are clenching a lot, or if
Yes.
it is hurting anywhere in the mouth, we must
Yes.
consult a dentist to determine the problem and rectify it early because a stitch in time saves nine, right?
Absolutely, absolutely. Yes. So because all these things, they eventually lead to loss of teeth. So once you lose teeth, the same thing. You don't eat well, you don't chew well. So if you're not chewing your teeth or your food well, so you start having gastrointestinal issues, as in your stomach issues, like acidity. We've seen people coming and saying that we've been having this acidity or digestive issues since ages, and they don't know the problem is, and they've been trying to go to the gastroenterologist and trying to try their own things, but they don't know the root causes lies in the mouth. Because you're not chewing your teeth well, it's not being digested well. You gulp, you try to gulp your food, so they don't get it doesn't get digestive, the juices and all. Even if they're there, the digestion isn't that good. So if you the moment you correct the teeth, or you give them a good set of teeth, the chewing efficiency gets better, and eventually the problem of your stomach gets sorted. So you need to make sure that the chewing is good, you are chewing well, you're eating well, so that your nutrition that your body needs at that time is taken care of. So all this, you make sure that you do not lose your teeth at an early age or at that age. And the good part is, maybe about few decades ago, it had been seen that 50% of people above 65 had lost most of their teeth. But thanks to the advancements, thanks to the technology, that now it has been seen there are a lot of people more than 65 who have their teeth and they're absolutely fine and the teeth are in good health. That is because of the dental care that they've been taking throughout their life. So even if I would want to say this, even if you haven't been doing that, now is also, it's never too late. Even if you take care of them now, I think it does the trick. So that is important. So now talking about the oral hygiene tips, we've been talking about taking care of your teeth, taking care of your teeth. How is, the most important bit. So first, brushing. Brushing is the most important thing, and brushing, if possible, after every meal would be excellent. If not, then at least twice a day. So, and brushing using a soft brush is very, very good. No need of using anything very hard or harsh or very abrasive on your teeth. So, a soft brush for patients who have arthritis, dementia, I would suggest that you can use an electric brush. That comes very handy and it is easier. In case you're lacking the skills of brushing, or you would want to try that if you're not able to do the normal regular brushing strokes, then an electric brush is an excellent choice. So you can use that for brushing. Then talking about flossing, that again, people are not aware of what a floss is. So when I say a floss, I'm talking about a thread. So that thread which is meant for cleaning the areas in between your teeth. So because when you do the normal brushing, that those areas which are in between the two teeth are left untouched. The brush doesn't reach that area. So you can use a floss. You get disposable flosses, you get regular flosses. The whole idea remains the same. Flossing in between each and every teeth has to be done and has to be made a normal practice with your brushing every single day. So that is very important. Then toothpaste. Commonly, people are not too sure of which kind of toothpaste to use. You get toothpaste which has salt, you get toothpaste which has a lot of things, but we should stick to a normal gel formed fluoridated toothpaste which has fluoride. So gel formed is basically not very abrasive on your teeth. So it makes your teeth clean, At the same time, it doesn't harm the upper layer, which is the enamel. It doesn't wear off the enamel. So a fluoridated toothpaste should be a good idea. And then you talk about eating. So eating well is very, very important. Eating healthy, very, very important. So that also makes sure that your cleansing action, a lot of roughage is going, the cleansing action is being taken care of. And then quitting smoking or tobacco, that also is very, very important. Apart from this, you need to decrease the intake of sugary food. So, or sugary drinks, colas, any aerated drinks, any, these kinds of things also increase the chances of decay. So, sugary food should be decreased. And yes, drink a lot of water and visit your dentist regularly for a checkup. These are the things which are very, very important and should not be missed no matter what.
So we should not be waiting till we have a problem and visit a dentist. So what should be a frequency of visit to a dentist in a normal, regular person who has no dental complaints?
See, ideally, we would recommend once in 6 months. So if you come once in 6 months, anything which is coming up which you might not notice, a professional might be able to see and notice and correct it at that stage, rather than waiting for any pain or associated problem to come up.
Yeah. What is scaling, doctor? Scaling, what is that?
Okay. So scaling is basically, when we say once in 6 months, what we basically do is the checkup, anything coming up, and yes, a scaling. Scaling is a professional terminology or a medical terminology used for cleaning of your teeth. So when we say cleaning, people say that we've been brushing twice a day. So why would we, actually need to go to a dentist for the cleaning, which we can do at home? But there are a lot of calcifications which happen in the mouth. So all the dirt gets calcified and hardens and becomes like a tartar. So the hardened dirt which gets accumulated around your teeth, it cannot be removed by normal brushing. You need those scalers which vibrate, and that they have that capacity to take out those hardened dirt. So that needs to be done to make sure that the gums remain healthy. So that is a professional scaling which needs to be done once in 6 months on a regular basis. That is like that's the least you can do for your teeth.
So a lot of people are seeing self-medication themselves, taking antibiotics and other stuff. So do you think it's a good idea, if there's a dental pain, take some kind of medicine at home? Do you think it is recommended?
Absolutely not. Because when you are taking there are two problems associated with them. When you're taking any kind of painkiller, you're basically masking the pain that you have, and you're masking the symptoms. So basically the cause remains the same. If there is pain, there has to be underlying cause for it, right? So whether it is to decay, whether it is gum issue, gum inflammation, gum infection, whatever the cause is, by masking it, you're not solving it, you're not treating it. So unless you go and see a dentist and get to know what the problem is and get the treatment done or correct it, there is no point masking it. The problem eventually will keep increasing. So if you keep having painkillers or antibiotics anyways, you end up, there are people who keep having antibiotics and end up getting resistant to those antibiotics and leave apart, doing whatever harm it is doing on your body. So antibiotics and painkiller can just mask it or cover it up for some time. But if it is because of any kind of, for example, decay, so you take antibiotics and painkiller, that time you'll be sorted, but the decay will eventually, which was okay, and you could have maybe saved a tooth by a root canal or whatever treatment. Now, because you haven't done any treatment, the decay further progresses and reaches to the stage where you need to get your tooth extracted. So eventually you are ignoring it, and the problem keeps increasing because of that. So it's not a good idea. Absolutely not a good idea.
What about the use of mouthwash on a regular basis? Do you recommend that?
See, any kind of mouthwash can be used. It's not that it can't be used, but yes, any mouthwash should not be used for more than 21 days at a stretch. So, because, then it starts causing a lot of staining on your teeth, which people don't know. People feel that staining could be because of any other local factor. But actually, the mouthwashes also cause staining. There are a lot of mouthwashes which cause staining if used for more than 21 days at a stretch. So a mouthwash can be used, but please make sure that you stop after 21 days. Give a gap of about 2-3 weeks, maybe about 2 weeks at least, and then start it off again. Otherwise, on a regular basis, normal rinsing after every meal is also very good. If you're doing the other oral hygiene regime is good. So even normal rinsing after food is good enough.
So why the teeth become yellow over time and how we can prevent that?
Okay, yellowness could be a lot of factors. That could be because of the local factors, the eating and drinking habits. They also could change the color of your teeth. And but yes, what is very, very common, which happens at a later stage in life, is because the enamel, which is the superficial or this covering structure of all the teeth, is ideally white. So over a period of years, because of the wearing and tearing and the chewing, grinding of so many years, what happens is the upper layer starts going off, starts wearing off. So the second layer, which is the inner layer, which is called the dentine, is a yellower layer. As it is, it's yellower than the uppermost layer. So once the upper layer goes off, the enamel goes off, the inner layer is more exposed. So you tend to, your teeth tend to appear more yellow because of the layer which is exposed. So
So,
this is more to do
doctor,
with wearing. Yeah.
when we have a car and we try to preserve its paint, we put a wax coating over that and that
Hmm.
preserves the paint. Do you have any wax
Yes.
for the dental enamel so that it is preserved, doctor?
I wish we did. No, we don't have anything like that. We don't have anything like that. But yes, in case the cause is known and we get to know the cause at an earlier stage, like grinding, if we know that at an earlier stage, we know there's a lot of grinding happening and we can see the enamel is just started to wear off. There are things like night guards, which is like a plastic kind of a layer, which we ask the person to wear if the grinding is happening at night. We ask them to wear it overnight so that the effect of the grinding is not there on the teeth and the enamel doesn't wear off to the extent that the dentine, the inner layer, gets exposed and they start appearing yellow or you have sensitivity. So if caught at the right time, we can give these guards to make sure that doesn't reach to that stage.
And how to prevent sensitivity?
I'd say sensitivity, knowing the fact helps in prevention. As I told you, because of the gum going down, the receding of the gums, and the exposure of the root, which is ideally covered. It's a sensitive part and ideally covered by the gums. So, in case the gums go down, the root is exposed to your whatever you eat and drink, causing sensitivity. So first, yes, taking care of your gum. So gum issue needs to be sorted at an earlier stage so that it doesn't lead to that the recession of the gums. Apart from that, any kind of decay. Also, when the second layer, the dentine, which I told you, is getting exposed, the decay reaches the inner layer. So that is also one of the reasons why you start getting sensitivity. So knowing the reason is very, very important. And the abrasion, as I told you, the clenching, night grinding, any wearing and tearing, causing the enamel to wear off. Again, you start having sensitivity. So knowing the cause and treating it does play a vital role in this. And in case it's something which is very minor, then using the desensitizing toothpaste also help to a certain extent. But yes, you need to first take an opinion, a professional opinion, to decide whether it is going to be a good idea to just use the toothpaste and not go for any other treatment, or you would treat something else with it.
So, what is the use of dental fillers here, doctor?
What kind of dental fillers are we are we
Uh,
discussing about?
there
A
is
lot of dental
sensitivity.
filler.
So, when there is sensitivity, doctors put some kind of white paste kind of thing which is fitted near the roots of the teeth, and then the sensitivity goes down. What's that, doctor?
No, see, these dental fillers are basically fillings that we are talking about. So fillings
Okay.
could be anywhere. So in case you have, like tooth decay I was talking about. So in case it's just confined to the upper layer, which is very minor, or any kind of cavity. So when you seek a professional help, they eventually treat it. Treat it means we do the filling. Similarly, in case the gum goes down and there's recession, the root is exposed. So either we treat the gum or we do these kinds of fillers. Basically, there are coatings which are done so that any kind of sensitive areas are covered, and whatever we eat and drink doesn't reach it. So the sensitivity is not there. So that's exactly what I meant. That you need to go and decide what is the cause of the sensitivity to make sure that whether you need a dental filler, whether you need any kind of gum surgery, whether you need normal fillers. Also, what needs to be done, the cause needs to be first seen to decide what kind of treatment is required.
So sensitivity could be a symptom, but the diagnosis could be varied and the treatment can vary depending on the diagnosis.
That's right. That's right.
Right. Questions, more questions, please. I think we are done. So thank you, Dr. Ritika. It was wonderful
Most
talking.
welcome.
You've been very knowledgeable and you answered to the point and beautifully. You're very, very knowledgeable. Thank you so much, Doctor. We appreciate your help and hope to seek your services anytime soon. Thank you, Doctor.
Thank you so much.